Okay, good morning class. So for today, we will do the thoracic and lung assessment. So first, prepare the necessary equipments. This includes the stethoscope for the auscultation, a centimeter ruler for the measurement of the diaphragm exertion, a skin marker or a pencil, and gloves, which is used for additional infection control aside from hand washing, because sometimes a patient have a lesions or any wounds on the anterior and posterior area. Okay, so it is safer to use a gloves. Also, laboratory gown for the patient. If none, that's fine. Let the patient use a thin clothing for the examination purposes. Okay, sir? Okay. Okay, so next is prepare the patient in the environment. So, first and foremost, you have to introduce yourself, verify the clients, and explain the procedure. Okay? So, good morning, sir. My name is Mary Grace Paran, and I am a student of Cordillera Career Development College, and I will do the thoracic and lung assessment. This includes, sir, the inspection, palpation, percussion, and auscultation of your anterior and posterior thorax, and that you will be needing to expose it. Okay, sir? But I will make sure that I will provide privacy and warmth. Okay, sir? Okay, so what is your name?
I am Emerson Paran,
And what is your birthday?
June 30, 2000.
Okay, thank you. That's a beautiful name. Okay, so you have to ensure it provide privacy to the client and make sure that the room is well lighted and warm for the patients to be comfortable. Okay, so next is you're going to obtain health history and do hand washing and put on your gloves. Okay, so obtaining your health history will help you to define what is the abnormal and abnormal findings. Okay, sir, do you have any history of smoking?
None.
None. Okay, how about history of lung disease?
None.
None. Okay, that's good, sir. Okay, sir. I'll be back after a few seconds. Thank you. Okay, sir, I'm back. Okay, so, sir, I will expose your anterior thorax, okay? So first, I will do, sir, the overall assessment for the thoracic and lung assessment. Okay, sir? Okay, let first position the client in a sitting position. And observe the skin color, the structures, the symmetry, and configuration. Okay, so I have observed that the skin is pinkish and it is consistent with the rest of the body. Okay, so as we can see, the clavicle area are symmetrical and the sternum is in midline. Also, the costal angle is less than 90 degrees. Okay, and then observe for the respiration or the respiratory rate. Okay, by observing the respiratory rate for a full minute, the patient breathes 18 counts per minute. Therefore, it is within normal. Okay, so Next is the palpation. Okay, position the client in a supine position. However, you may tell the client to sit in remain in a sitting position if there is any discomfort of the patient. For example, difficulty breathing and feeling of dizziness. Okay, sir, do you feel dizzy or having a difficulty breathing?
A little bit.
Okay, sir. So, for that, you will remain in a sitting position. Okay, sir? Okay, so, palpate the sternum, the ribs, and intercostal space. Okay, you're going to palpate. Okay, so the sternum is flat and the ribs are smooth and even, and for the intercostal spaces there are no any deviation noted, so therefore there are symmetrical, so the findings would be normal. Okay, so next is we're going to lightly palpate the anterior thorax and lateral thorax and assess for any muscle mass growth, nodules, masses, and tenderness. Okay. Okay, there are no any nodules or masses or any tenderness noted. Okay, so the muscle mass is firm, therefore it is within normal. Okay, so next is we're going to palpate for the respiratory expansion. Okay, with the use of your palmar hands and your thumb, place it on the costal angle and observe for the movement. Okay, sir, take a deep breath. Okay, thank you, sir. Okay, so upon palpation, the client breathe evenly and smoothly, so as evidenced by my hands, which is lifted evenly. Okay, so therefore it is within normal. Next is palpate for the tactile fremitus. Okay, sir, starting from the clavicle area. Repeat what I will say, sir. Okay, so repeat after me. 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Okay, so the vibration is palpable on the chest area, therefore it is within normal. Okay, so next is for the percussion. It is important to visualize the landmarks, percuss the lungs, and expect what is supposed to be expected findings. So it should be resonance. Val is for the abnormal findings. Okay, so let's start the percussion. Okay, we'll start with here. Alright. Upon percussion, resonance sound is noted. There is no dullness noted, therefore it is within normal. Okay, so as I move my hand during the palpation from large to small airways, the fremitus diminishes. Okay? Next is for the auscultation. We're going to auscultate for the trachea and apices. Sure. Okay, so for the trachea and apices, I have heard that the tracheal sounds are heard, so therefore it is within normal. So next is we're going to auscultate for the bronchi, which is located on the second and third intercostal. Okay, second and third intercostal. Okay, so the bronchovesicular sounds are heard, which indicates normal findings. Okay, so next is we're going to auscultate for the anterior and lateral lungs. Okay. Okay, so there are no any abnormal sounds noted, which includes the wheezes, stridor, coarse, or fine crackles. Therefore, it is within normal. Okay, sir. Thank you very much. And we're going to move now for the posterior thorax. Okay, sir?